testing in Tarrytown is from 2 to 7. And then St. Michael Baptist Church on Thursday from 2 to 6, that's in Kenner. And then, of course, our Ilario Center that's been open really since this started, one of the first federal pilot testing sites. Ilario Center every Monday through Friday from 8 to 4 and Saturday from 8 to 2. And you can pre-register for Ilario Center testing at health.questdiagnostics.com. And then on Thursday, Friday, and Saturday, we have a group called CORE, Community Organized Relief Effort, is hosting free testing at the Hispanic Apostolate. So every week we have new testing sites in the community. It's something that we're very proud of. We try to get well into the community, covid.jeffparish.net, and we try to partner with lots of people to offer as much free testing as possible, because we know that is a very real part of our fight in COVID. So lots of questions now on the vaccine. And there's sort of a lot of misinterpretation or misinformation out there. So everybody who's getting the vaccine now, understand that these decisions are made exclusively by the state. The tiers that we're in and the different phases, who's getting the vaccine, when people will get the vaccine, these are decisions made by the state, and they're waiting for their federal supply to come down, and they're pushing it out across the state. So we in Jefferson Parish don't make those decisions. We are in, as the state has indicated these tiers, the Louisiana Department of Health has phase 1B in tier 1. That's about 640,000 people. Okay, so this is where we are, age 70 and above, and a lot of other community, behavioral health, dental providers, a lot of those related medical providers. So right now, if you have received your vaccine or if you're scheduled to receive your vaccine, it's really only of one of three ways. It's through your hospital, it's through an approved pharmacy, or it's through a federally qualified health center, an FQHC. That's the only way you're getting this vaccine now in the state. So there are over 1,800 enrolled providers through the state. Not all of them have the vaccine yet. I think it's about 300. And we have 27 vaccine sites in Jefferson Parish. So you can look at the full list, covid.jeffparish.net, and the state at ldh.la.gov/COVID vaccine. So that is the only way. We in Jefferson Parish look forward to when the supply opens and widens up and the product becomes more available to help with that, because it'll get to a point when that supply loosens that the providers are not going to be enough to really do mass vaccinations and get our community where it needs to be, and we stand ready for that, but we're not at that point yet. Joe Valiente is here. Our team is ready. We have been doing drills. We have the equipment and the infrastructure ready. So as soon as we're able to get some and as soon as supply is there, we can expand that to more drive-through, high-volume events. We're not there now, but we stand ready in Jefferson Parish, as so many parishes stand ready to widen that distribution when the time is right, okay? We want to encourage everyone to consider taking the vaccine. It really gives me hope that I know more and more people who have gotten their first shot. Some people have gotten their second shot. I'm happy to say my mom got her first shot already. So we're all anxious for the supply to increase. I look forward to taking it when it's my turn. For me personally, knowing people, and it's in conversations, I got my vaccine, or you hear somebody saying my aunt got their vaccine, all of those things just strengthen my own perseverance through this, that the daily decisions I make to not let my guard down until I can get vaccinated. And I hope everybody has that same mindset. We're right there now when people in the community know they have it, they're getting vaccinated. Let's all really buckle down, because we don't want to get it now if you haven't gotten it already. Now that the vaccine's out and it's being distributed, you don't want to get it now. And if you had it already, there's evidence that you can get it again after a certain period of time. So I encourage everybody to take the same mindset I'm taking, buckling down until you can get vaccinated. So I want to get back to the days where we're plateauing in Jefferson Parish at a very low rate. And I want to get back to the days where at noon, I'm hoping it's 30 cases and not 45 cases, and somewhere very far from where we are now with, 250, something like that, cases. So we have work to do. Remember what we all know: avoid group gatherings. Outdoor is better than indoor. More ventilation is better than small closed-off rooms. Working remotely as much as possible. That's certainly the mode we're in Jefferson Parish. That's the mode I'm in. I'm doing more Zoom meetings. I'm not losing any information, and I'm not giving out any information on my Zoom and my team meetings. So encourage that, wearing a mask, social distancing, washing your hands, all of those things. And really, it's the small gatherings, family group gatherings, the baby showers, those things that people can tend to let their guard down because you feel very familiar with the people that are close to you, and we know that's how this is being spread. So let's be very mindful of that. So in December, the Coronavirus Response and Relief Supplemental Appropriations Act, we were able to get some assistance with these programs. So we've recently been awarded $12.8 million in emergency rental assistance funds, which is a very much needed. So the assistance can last up to 12 months, plus an additional 3 months if necessary to ensure housing stability. So the primary objective is to keep people housed during the pandemic by preventing evictions for failure to pay, and to serve the maximum number of households as quickly as possible while prioritizing the neediest and ensuring equitable geographic distribution of that assistance, and of course to compensate landlords for unpaid rent during the eviction moratorium. So eligible households include families that have income below 80% of the area median income, and the family has an obligation to pay the rent, or a household member who has a reduction of income because of COVID, a financial hardship, or a family has experienced homelessness. Okay, so we stay tuned for additional information on that. When we work down our process on how we're going to manage this, we will let you know. But that is very big news for Jefferson Parish and some much needed relief. We also received a transit grant as part of the $14 billion transit and infrastructure. We'll receive $7.2 million for our own Jefferson Parish transit program. You'll remember for quite some time we let transit ride for free, so there are expenses there that we're able to fill that hole. So encourage everybody to stay updated with us, Jeff Parish, www.jeffparish.net, and covid.jeffparish.net. And of course, we're on social media, Facebook, Instagram, Twitter. For daily text alerts, text JP Alert to 888-777, and our Spanish-speaking citizens, JP Noticias to 888-777. So today, it's my honor to introduce the new Region 1 Medical Director for the state of Louisiana, Dr. Chantel Hebert-McGee. She is taking Dr. Cantor's place, so everybody can put that in perspective of the position she has. Dr. Cantor is the Interim Assistant Secretary for the Office of Public Health, and he was always here with us. So today we're honored to have Dr. Hebert-McGee with us. Dr. McGee is a physician as well as a health policy advisor. She's the founder of Under the Scope Foundation, which examined the intersection between technology, health access, and education to mitigate the environmental factors associated with disease, especially in underserved communities. Dr. Hebert-McGee is a graduate of Mount Carmel Academy. You know I had to say that. Earned a medical degree from Georgetown School of Medicine and a Master's of Public Health policy from Harvard T.H. Chan School of Public Health. So with all that, I want you to meet our new Region 1 Medical Director for the state of Louisiana, Dr. Hebert-McGee.
Thank you, Madam President, for that warm welcome, and it's a pleasure to be here. So the exciting news that I have to share is that there is significant enthusiasm for vaccines. The uptake, the demand has far outpaced our supply. And this is not only locally, but this is also nationally. So because we have limited supply for the next few weeks, we're going to have measured allocation throughout the state and throughout the region. However, we have a new administration that is committed to increasing vaccine availability, and they plan on having more locations as well as revving up the actual production. So that's promising. Thus far in the state, we have given more than 300,000 dosages, and in the region over 66,000 dosages. And so this is very promising because we know everyone is almost everyone is interested in having this vaccine. Nonetheless, we know that there are obstacles, particularly in the supply. And one of those things that is of interest, and I guess it's news that's forthcoming, is that Johnson & Johnson is expected to have a vaccine come to market in the next few weeks. The interesting thing about this vaccine is that it is a single-dose vaccine, so therefore it should be easier to deploy, and we anticipate that they're going to have emergency use authorization approval. So we look forward to that, and hopefully that will increase the supply more readily, and we can vaccinate all the residents within Jefferson Parish as well as throughout the state. A caveat is that we know that the public is concerned about equitable access. I think I can speak on behalf of Madam President and myself, is that we want to make sure that all communities have access to the vaccine. And we know that some communities have been marginalized, or there are other discriminating factors, particularly when it comes to resource allocation. We know that there are individuals who are transport limited. Some do not have networks of support. Some have language barriers, and some are not digitally savvy. So it's hard to make readily available, how do I put it, appointments. You know, it's easy to do something on your mobile device or on your iPad. And so we want to make sure that those communities that are geographically isolated and do not have FQHCs or pharmacies, that they also have access. And right now, while we are in Tier 1, that those who are 70 plus, that they also have access, even if they do not have transportation that is readily accessible. Intention does not always match behavior. So even though we have a concerted effort to try to reach these populations, we know that there is some vaccine hesitancy, right? There are particular sectors of the population who are skeptical about the vaccine. And I want to validate their skepticism, not from the vaccine, but because there has been historical and social factors that have caused certain groups to feel alienated, marginalized, and they have really been insular. And so it is my duty to inform them that the two vaccines that we have currently available, Pfizer and Moderna, during their clinical trials, they included groups who have been traditionally not included. Individuals that look like me, individuals that look like everyone on this panel. So I want them to feel confident that the vaccine is meant for everyone and not just for certain sectors of the population. And this is important right now because there are new variants. And we don't want to see another surge. We don't want to see increased, cases of people in the hospital or increased deaths because individuals feel skeptical about the vaccine. As Madam President mentioned, there are misconceptions and myths that have been perpetuated through social media. But the vaccines that we have currently available, they are relatively innocuous. There may be some slight pain at the site of injection, but there are very limited, I would say, any significant consequence, right? We know that there are more adverse side effects if you don't take the vaccine and actually contract the coronavirus. So with that, I ask that everyone continue to stay vigilant, that everyone continue to adhere to the precautions that we have prescribed to. So social distancing, wearing your mask, washing your hands. And currently, we also, I know that the governor and the secretary and Madam President, that we want people to have access to all the different modalities that exist in order to stay safe. And the Department of Health has recently released a free application. You can find it at coviddefensela.com. And so it's a free app that allows for you to readily find out if you have possibly been exposed to the coronavirus. So without getting to the details when it comes to tech, your phone sends anonymous pings to other phones around it. So if the other person has been enrolled into this application, they test positive, they're able to see who other phones were in close contact to theirs. And so you will be able to get an alert stating that you have possibly been exposed. The good thing about this particular application, it is anonymous. So it doesn't invade any of your privacy. You don't have to use your real name in order to partake in it. So to reiterate what Madam President stated, it's important for us to continue to stay vigilant and recognize that we're not only accountable for ourselves, but we're also accountable to each other. Thank you.
Thank you, Dr. Aber-McGee. Next, we have our coroner, Dr. Jerry Satanovich here. And I know there is a lot of questions about sometimes the death numbers that come on that statistic, so I know he's going to straighten that out for us.
Good afternoon. Like Parish President Sheng said, we are in our third spike. This spike, as far as number of cases, is much higher than the previous ones. Thankfully, the number of deaths has not followed that. Like we had, I think back in March, for example, we had 280-something deaths here in Jefferson Parish. This month so far, we've had 75. And that's a real testament to the hard work of our healthcare community and to the research and development of new therapeutics. So that's a great sign that we're heading in the right direction. Thankfully, we're on the downside of this particular episode. I want to respond to something. I know there have been a couple days this month where the state reported over 20 deaths in Jefferson Parish, so people had a lot of questions about that. I think a lot of these deaths get batched over a couple of days. In no day this month have we had more than 7 deaths. That's 7 too many, but no day have we had more than 7. Most days it's 4 or 5, but that's kind of the way it is here. But I think what makes the confusion is the state. It takes a few days to get them together, get the information, and batch it together. I want to emphasize to everybody to get the shot. I do want to bring something up because so many of us are used to getting the flu vaccine, and typically after you get the flu vaccine, 10 days after you get the vaccine, you have a very good immunity to the seasonal flu. The COVID vaccine is different, and so I want to emphasize to people, don't think that because you got the vaccine a week and a half ago that it's going to be like the flu and that you're immune now. Even up to a couple weeks after getting the first dose of the COVID vaccine, you're still only at about 50 or 55% of immunity. It takes a full week after your second dose before you're sufficiently immune. So in that time period, we're talking about 4 weeks, people can't let their guard down and assume that they're going to be okay. You can still get COVID. We've had a few deaths of people who had the vaccine and ultimately got COVID separately from the vaccine. So I want to emphasize to people, please don't let your guard down. That'll do it. Thank you. I'm available for any questions after.
Thank you, Dr. Satanovich. One of the surprises, certainly, that I felt that has happened this year is, and I would never have imagined it, is that our Jefferson Parish economy has remained very strong. Our sales tax collection, and the sheriff is here. He is our sales tax collector. The properties that are moving, the value of the homes have increased, and that trend, it's like 33% over the past since 2016 or 2017, and this year has not dampened that at all. Part of the reason of that is we have a very diverse economy that was able to withstand these massive changes that we've had this year, and another part is we have strong business partners. So with that, I'd like to introduce Mr. Jerry Bologna, who is our Jedco Executive Director.
Thank you, Madam President, and I was going to start with those exact same sentiments, and that is first to thank our corporate entities throughout the parish for continuing to operate responsibly and safely, but to also recognize our residents for supporting those businesses. I think the stability of our revenue numbers in Jefferson does speak to the diversity of our economy, but also the resilience of our residents and their support of those businesses. I want to mention a few things that are available to our businesses. Some of those, of course, will be repeat information, but both the first and second draws of the PPP program are still open. The application periods are open. We do have a list of SBA vendors and programs available on our website at jedco.org. The EIDL, the Economic Injury Disaster Loans, are also still available. That application period is open through December of this year. One item that has not been mentioned very often, but is a significant incentive for our businesses, is the Employee Retention Tax Credit. We're encouraging all of our businesses to take a look into that. It's a significant tax credit whereby a company can receive up to 50% in payroll tax credits for the first $10,000 of compensation that they utilize to retain their employees. That credit has been extended through July 1st of this year. The other thing that I do want to mention, our partners at the Jefferson Convention and Visitors Bureau have issued the Clean and Safe Pledge. We encourage everyone to look into that, and it does not need to be a hospitality-related business, but we're encouraging all of our businesses to take that Clean and Safe Pledge as a signal to your customers and your employees that you're taking all of the appropriate accommodations and safety precautions to keep everyone safe. And you can find that information at the Jefferson Convention and Visitors Bureau, as well as on our website at jedco.org. And with that, I'll introduce my counterpart, Todd Murphy, the president of the Jefferson Chamber.
Thank you, Jerry. Just to reiterate a little bit, to complement our parish council and our parish president, as we've dealt with this, we've not only seen a severe hands-on approach to public health, but also a hands-on approach to keeping our economy healthy. And we've seen the results of that. And even in the midst of this pandemic, our councilmen are at work. My counterpart at Jedco is at work, bringing businesses in. New restaurants are opening, shops are opening. The grocery stores are packed, and they're doing very well. But it's at this time, too, that just as we can't let our guard down from a health perspective, we need to continue to help our businesses here. We need to buy local. We need to spend local. We need to get out to our shops. If you have the wherewithal to go out and buy some gift cards and give them to people in need, let's do that. We have a very healthy economy here, and the message that we're sending is that Jefferson Parish is open for business. We want more businesses, and we need to help the businesses that we currently have. And so that's my plea to everyone today, is to please spend local, get out there and support our economy. You can order it online and pick it up at the curb. You can call a lot of places and pick it up at the curb. You don't have to go in if you don't feel safe doing that. But there are lots of ways to buy from our local merchants and our local restaurants. And so we just urge you to please consider supporting all of our vendors throughout Jefferson Parish. Thank you very much.
Thank you, Todd. With that, I think we'll open it to any questions that anybody has. Aubrey?
Couple questions. Touch on vaccine levels. I know Auctioner had to cancel some appointments. How concerned are you going into the coming weeks with the vaccine supply levels currently?
So what we're told is that the next couple of weeks is kind of the same as where we are now, but I can let Dr. Aber-McGee, if you have more drill down numbers on that, but do you want to address that? Come on.
We don't anticipate having any decrease, nor do we expect to have any significant increase, maybe 10% at most. The good thing is that the Pfizer vaccine, which was previously allocated for only 5 doses, has now been approved by the FDA to have 6 doses. So that angel dose that they were able to squeeze out has now been allocated for all vials. So it's no longer just 5 doses, but it's actually 6 doses. So that will give us a little bit more coverage that we didn't previously anticipate. As I mentioned before, there is believed to be another vaccine that will soon enter this, I don't want to say market because it makes it sound like a business, but it will soon become available if it gets the EUA. And it's very promising with Johnson & Johnson, and that will be a single-dose vaccine, so it'll be easier to administer, particularly when we're talking about those who are transient. We know that there are parts of the population that is hard to track, so they may come in for 1 dose, but it's hard to give them that 2nd dose. And so we think that having a vaccine that will only require 1 dose will help certain sectors of the population. But we don't anticipate having any difficulty with actually providing sufficient vaccine for those who need 2nd doses and continuing with the allocation we have for first dosage.
Do we know how many cases of the UK variant have been tracked in Jefferson Parish?
So there have been suspected cases in Region 1 that I can say, and those cases have been sent to CDC for sequencing. So we are waiting to see what the results are.
So is there any confirmed cases so far, or
Oh, no, not in Jefferson Parish.
what restrictions could be lifted to within Jefferson Parish?
In regards to,
Businesses and capacity levels, is there any info on what, some businesses want to know what could be in the works in the coming weeks, if anything is loosened or?
so I don't have any information to speak towards that. That is not at my particular pay grade. So I can't speak to what restrictions will be lifted. So I think that's a question when it comes to the governor. So.
Yes, this modified phase 2 we're in is through February 10th, and then the governor usually, as I said, the day or two before that will announce what happens after that, and we follow that.
Is there any changes that could be in the works for school, or is it just kind of expected to stay the same with kids in person, distancing?
Yeah, I would expect that it's the same for now. You know, I know schools have been very, very flexible, you know, and I think it's you know, you hear different things, but I think they're trying to get the kids in school for as long as possible, but then sometimes you hear they have to quarantine, so it is something that they've managed, and I have to say, I think they've done a pretty good job at trying to maintain the school year and not lose the school year, while also trying to manage COVID, but.
And I know there's promising info, like you mentioned with the vaccine numbers. Are you concerned about the amount of vaccines that are currently in Jefferson Parish?
I think we all want more supply as quickly as possible. You know, I want to get vaccinated as quickly as I can, and it'll be my turn probably when the essential workers, probably the next phase 1B, tier 2. I think we all want it to come quicker than possible, but it is a Herculean effort to do this across the world and across the country, and also managing that second dose is not easy. You know, it's not like testing where you take the test and, you know, goodbye. It's having to bring that person back at the same time at a 21-day or a 28-day time frame is a very difficult thing on the logistics of it. And I think the other difficulty is that the state gets a very short window of time for the amount that they're going to get for that next week. And so in terms of the planning, that's very difficult in terms of planning. And so I think we saw this when testing happened. You know, it was a little rough start, and how could it be otherwise, right? And it smoothed out, and I fully expect that to happen with this process as well. But we stand ready. It's not like Louisiana is not managing this well. It's not like pharmacies are sitting on vaccine and product. It's just a matter of we're not getting it from the federal government to be pushed out to us. So I would have major concerns if providers in Louisiana, because of scheduling, they don't have the right scheduling system, they don't have the data input, they don't have the people to actually give the shot, and they were sitting on, you know, vaccines. That is a process problem, that's a management problem, that's a planning problem here. I do not get the feeling at all that that's what's going on. It is just a matter of we're waiting to get whatever we get from the federal government, and we're only 1.46%, I believe. We only get 1.46% of the country's supply, because that's what we are in Louisiana in terms of population. So, okay. Any other questions? I want to thank you all for being with us today. Thank you very much.